Thank you all for being here today for our Northeast 2025 Session 1. All right, and we can go ahead and get started. Well, thank you everyone for being here. Welcome again for anyone that has just joined. This is our 2025 Northeast CPI Session 1. Let me go to the next slide. Here we go. Hi, everyone. Thank you for joining. Please, just a couple of housekeeping items. Please update your Zoom name with your organization and any other information that you'd like to include in your Zoom name. Our icebreaker chat question today is, what do you want more of in 2025? If you're a resolutions person, did you make a New Year's resolution? If not, do you just have an idea of something that you want to incorporate into the year ahead more? So please go ahead and drop that in the chat. And then also just, we really want to make this session as engaging as possible. So, listen to each other, engage, feel free to use the chat, come off mute. And we're really looking forward to this session and planning for this year ahead and all of the work that we have for this year. I see follow through with self-care routines. That's always a good thing to aim for more of. Money. Car. Ooh, ice climbing. Wow. That sounds really fun. Travel, money, buy from more small businesses. Yeah, I love that one. Well, thank you all for sharing. We'll move on. So welcome to everyone who is a returning participant, anyone who's new to this space. Thank you so much for being here. We're thrilled to have you here. And just as a reminder, this is a space for regional Medi-Cal transformation, or CalAIM stakeholders, to collaborate, identify challenges, and problem solve with the goal of improving CalAIM implementation and really driving utilization. So welcome, and please feel free to ask questions. You can use the chat throughout the session to ask questions, but also we're available via office hours and one-on-ones, and we'll talk about some more opportunities to connect with us that way. But just want to pause here and see if there's anyone new. Is this anyone's first session? And if so, would love for you to come off mute, say where you're joining us from, and say a quick hello. All right, so it looks like maybe we all have returning folks. But if at any point you, oh, great. Hey, Stephanie. Good News Rescue Mission. Great. Thank you for joining us. All right, so we will move on to reviewing the agenda for today. So after we do this level setting, we'll move into some general updates, and we'll share some updates from DHCS. And then Partnership will join us and provide some MCP updates, and we'll have an opportunity for some regional spotlights. Then we'll move into a session where we will talk about PATH Cited and discuss the application resources that are available, upcoming webinars, because I know a lot of us are thinking about applying for Cited Round 4 and planning for that. We'll talk a little bit about looking ahead, preparing to apply, and really prioritizing those gap filling opportunities. And then to close out our session today, we will talk about alignment for the year ahead, really talk about our shared goal for 2025, and then we'll share some information about the upcoming in-person session, and then office hours and one-on-ones. So our objectives for today, first, are to receive important DHCS policy updates pertaining to funding opportunities and transitional rent, to receive important MCP updates pertaining to presumptive authorization, unsuccessful outreach billing, service gaps, and MCP trainings to discuss path-cited priorities, gaps, and opportunities, and then to select a collaborative goal to guide our work over the next year. And I'll pass it to Gretchen.
Great, thank you, Ava. Hi, everybody. Happy New Year. It's great to see you again. Hope everyone is doing well. So we actually don't have a ton of state updates. Surprisingly, they took a little bit of time off for the holidays. But we do have a significant one that I do want to share, and then we'll cover some regional updates, and then we'll jump into partnerships updates in a minute. But next slide, please. So the very end of December, the federal government, CMS, did approve California's waiver for the BH Connect services that includes transitional rent as becoming our 15th community support service in California. Yay, we're so excited. We don't know a lot about how this will be implemented or operationalized. And Brittany, if you guys know more, please jump in here. But we are awaiting state guidance to see what this looks like. What we do know is that transitional rent will be able to cover up to 6 months worth of an individual's rent. Of course, qualifying conditions will be given to us later. And the hope is that those folks will then get more rental assistance through some of the BH housing funding. Was also approved in the Prop 1 funding stream. So we'll look forward to learning more about that. And managed care plans can voluntarily offer transitional rent starting July 1st of this year, and then it will be mandatory January 1st of next year. So as we get more from the state, we'll pass it on, but really exciting that we can start to use some Medi-Cal dollars for rent in the coming months. Any questions on that? Are they the same? I'm sorry, you mean there's the transitional rent and the, oh, do you want to come off mute, make sure I'm getting your question right? I'm distracted by all the great comments in the chat.
Yeah, sure. I've been researching both of them.
Great.
And it sounds as if they're slightly different. So my question to you is, are they the same? Because there's BH Connect, and then there's transitional rent, which falls under community support. So when I was reading, I'm still trying to figure out, like, they're the same program or they're different. So do you know?
One. Yeah, great question. So transitional rent was part of the waiver that BH Connect was submitted, that California submitted to the federal government for approval. So it kind of sits under that waiver. So they are different. I think the hope for the state is that eventually, January 1st, 2026, transitional rent, which will be the 15 community support, will help folks with those first 6 months of rent. And then as that winds down, folks who are eligible would be able to get additional rental assistance through some of the BH funding streams. Again, we're still waiting for some details around this, but they are separate right now. They're just part of the same waiver that was approved in December. Any other questions?
Yeah,
all right.
I had a clarifying question.
Yeah.
So I haven't looked into any of this. So I do know that, like, the Discovery New Life Discovery Project has the ECM where they pay for the 6 months of transitional housing for medical respite, or their program there. Now, is that separate from what you're talking about right here? This will be something that's offered just through community support. So like me as a community support case manager, I would be able to provide, get them connected to the transitional rent through this.
Correct. Yeah, so it'll be another community support service that you can make referrals to or become a provider for. I think given the amount of money we're talking about, I think the state's looking to counties to actually get more involved to provide the rent or some of the other, county agencies. So it could be, coordinated entry and those folks that help coordinate all of this, but it should be another resource for you all to get folks housed. Okay. And hopefully we'll get more details soon about who's going to be eligible, how it's going to be operationalized. Because 6 months is a lot of money to, you know, how for housing deposits right now, you have to spend the money and then get reimbursed. And we assume
Right.
the rent will be the same, but they're talking about having flex pools that could be established to allow a little more flexibility, especially for smaller organizations or counties. So we're going to wait and see what happens. But part of PATH cited is to try to, I think, help fund some of those ideas, like how do counties do it? How do we create these flex pools? How do we think about making this really a doable thing so we can get folks housed and not bankrupt counties or organizations who are doing this? Anybody else? Great questions. And Brittany, jump in here if you have more info than I do.
Yeah, unfortunately, we also are still waiting on some guidance from the state. So you definitely have pretty much provided all the information I have as well.
Okay, great. Well, we'll hope for more. We'll hope it'll come soon. So wonderful. All right, next slide, please. All right, so the state has not given us a lot of updates, but they have asked for some more information from all of us who are doing ECM and community supports, and they're really trying to understand how eligibility is working for ECM and community supports. And so we wanted to just ask you guys so we can provide feedback to the state. What are some of the challenges that you've encountered with assessing ECM or community supports eligibility? Have there been any amazing success stories that have really made things easy to get folks into ECM or community supports? And again, the state's, I think, trying to think about what's working, what's not working, how do we make policy changes to ensure that this is not a significant barrier for folks. So we'd love to hear what you guys have to say, either in the chat or come off mute. But yeah, welcome your thoughts here. Do you guys have any issues with getting folks into ECM or community supports, or has that been a smooth process for everybody?
I mean, I can talk, Miss Greg. Oh,
I would love it, Loretta. Yeah, please.
so I haven't encountered any significant challenges, but what has become a challenge now is when I was at a round table, they call them office hours now, meaning they talked about people who have special Medicare something won't be eligible anymore. And that was a little confusing for me as to what does that all mean? What am I looking for? It wasn't clear. So that now becomes a challenge for me in assessing their eligibility. So I would like some more guidance around that particular part. I think they call it SNAP or NAP or something. Thank you.
No, I think that's a really good thing. There's a bunch of programs that folks can be duly enrolled in or couldn't be duly enrolled in. So how do you start to differentiate that? And I don't know, Brittany, if you want to jump in here with some more information or resources too, if they come up at your roundtables.
Yeah, absolutely. Thank you. So Aretta, I know we did touch on this on the office in office hours and the ECM roundtable / office hours now. So I believe we're talking about the DSIP members. And so basically there is an indication when you are looking in the provider portal through partnership that will indicate that the member is under the Senior Advantage plan. And I believe that indicator is at the letter F. I can also send you a snip via email just to kind of show you what that would look like under the eligibility details pop-up window. But yeah, there is identifiers regarding that. Yeah, no problem. I will definitely get that out to you.
Great, thank you, Brittany.
Of course.
Anybody else have any thoughts about eligibility? Oh, Larissa put in a bunch of different identifiers. Fabulous. Did anybody here ever submit a TAR and have someone get rejected for ECM or community sports?
I mean, I've had a few that have gotten rejected from community supports. Usually they're just asking for more information.
Okay.
Partnership does a really good job of specifically like what information they're looking for.
Wonderful.
We've kind of built a plan at Shasta Community about like what points to hit in our documentation to get those things covered, making sure that the patient, is more likely to be covered before we place them in a hotel. So making sure we're like hitting all of those points.
That's really good to hear. Have you had any amazing success stories you want to share with getting folks in quickly?
We have recently had a few people get housed, so that's been really great. And they've been housed not too long after they've left short-term post-hospitalization or while they were still in short-term post-hospitalization. I know housing takes a really long time, so it really just depends on how motivated the patient is and really just like our community, if they get lucky is almost what it takes sometimes. But I feel like we've been getting really lucky lately.
That's great. I like hearing that. Thank you for sharing, Shelley. And then Sarah, I'm seeing your note in the chat about you've had some folks who were not approved due to overuse of services. Do you want to explain a little bit more about what that might mean?
Hi, so the population we serve, I'm sure everyone's encountered this, you see them kind of come back a lot, they'll we work with Chester community providing medical respite services, and so sometimes people come to us for some time, deal with one issue, and then they leave, and then they come back a few months later for another issue, etc. So usually by the second or maybe even the third time they come back, all for sometimes related, sometimes unrelated issues, we're seeing rejections because, the reasoning is, it's not a housing service, it's a medical service. And we're like, well, okay, but these people have serious medical needs. So, what do we do? There's not an explicit like time cap. I know it's generally 90 days per TAR, but how many times can they do that before it's just a blanket rejection? Yeah, so it doesn't happen very often, I understand they have to have some kind of boundary with how much someone can use one service, but there's some people with just so many needs, multiple surgeries in a year. It takes time to deal with. So yeah.
And do you get a sense that if you were providing more information or different information that might help, or is that just kind of there's a line that's been drawn about how often you can use this or how much you can use?
It seems like a line. They're not asking for additional information usually at that point. We have, tried to provide more information when we have it, but I'm the one submitting the TARs for us, and I provide all the information that I have, and if I can, I'll go and ask the medical team for more information, and it's all on there, like diagnoses, treatment plan, upcoming surgeries, all these things, and they're just like, well, sorry.
Gretchen, do you mind if I say something real quick?
Oh, no, please jump in, Shelley.
Okay, awesome. Hi, Sarah. This is Shelley. I work with the HOPE team with medical respite and ECM. If you want, I can connect with you and maybe we can get Rima too, so we can kind of go over. I know partnership really likes to hear like risk and benefits, like risks if the patient was to go back out into the encampment, and benefits like keeping them out of the hospital and things like that. Those are words that they like to hear. I know partnership's on the line, so if I can get a thumbs up over that. But those are really important things that they like to see in their TARs, and we can go over that if that's helpful for you, because I know we work together and we're partners. So
Yeah.
if you need anything, I can give you my phone number and we can connect.
Yeah, of course, that would be great. Yeah, we always include that, but maybe, there's something that I'm missing.
Okay.
Well, that's great. And I'm seeing Brittany give a thumbs up. So thank you, Brittany.
Thank you, Bertie.
Thank you.
So that's really great. And I'd love to check in with you guys later to see if you can figure out a way to get those folks approved. So that'd be really something to follow up on. Make a note of that. All right. And Stephanie, I'm seeing that your comment too, and I'm hoping you can come off the line and share more about your challenge that you've experienced.
I don't think it's a challenge. I think, well, it kind of is a challenge, but I'm really new. I've probably only been doing this now for 2 weeks, and I'm at the
welcome.
Yeah. So I'm at the Good News Rescue Mission. I think the only challenge is I've met with some people, and I run their eligibility, and then it comes up substance use services only. And my first time I had that, I assumed they were member eligible, and I went to do a TAR, but that option wasn't available. So I'm assuming then that you're not able to submit a TAR or do ECM support if someone has substance use services only. Is that correct?
So they definitely need to meet the population of focus eligibility criteria. So they may need some additional information to approve a TAR if they are having substance use issues. And again, I'll welcome other people to jump in and share their experiences or partnership to share their thoughts on this too.
Yeah, absolutely. I can actually jump in. So if a member does not have a full scope eligibility, sometimes it is a limited eligibility. They would not be eligible for ECM. So they do have to have full scope eligibility. So I know there's a few instances that basically eliminate their eligibility for ECM based on their actual insurance. I hope that helps a little bit.
Yeah, that answered that question. Thank you very much.
Great. Thank you, Brittany. Thank you, Stephanie. All right. Anybody else? Oh, go ahead.
Yeah, I just have a quick question, and
Sure.
that's maybe directly to Brittany. So Brittany, under that instance, could that, like Stephanie, could she have gone in and assumed presumptive authorization at that time?
No, so presumptive authorization, which we'll obviously go through here in a minute when we pull up the slides, but that's basically not necessarily the county Medi-Cal presumptive authorization. That's essentially once you've identified that the member does have partnership, full scope eligibility, then you can essentially start obtaining services for that member prior to getting authorization, aka a TAR. So that's kind of what that means, which I know definitely sounds like it could be along the lines of the same, but that's doesn't fall into the same category. So yeah, so in that case, if the member would need to essentially broaden their scope for Medi-Cal, they would have to contact the county Medi-Cal office in order to kind of get some answers regarding that.
Great, thank you. Yeah, this has been really helpful, Brittany. Thank you for answering these questions and letting us know the resources we can go to if we want to expand someone's Medi-Cal scope. Thank you. All right, anybody else? All right, then we'll just keep going. I'll go to our next slide. And now we're going to turn it over to you all to see if there are any updates that you'd like to share with the group. Any successes, any challenges, anything you think is important about upcoming meetings or health fairs that you'd like to share. Now is the time.
I have a question. It's not really something to share.
Oh, go ahead, Kelly.
I just want to know if when you do your progress report for past cited, does are you able to like let's say we want to change my FTEs to be higher. This is real scenario to be higher because we underestimated our needs. Can we go back or can we only be paid moving forward? Like, let's say I know starting January 1st, I was, if this was the quarter that I was reporting in, let's say I knew January 1st, I was putting in much more time. I have documentation of that. I can show that. And so in our report, I stated that and asked for more time. Do they only pay us if for the things that were approved then and there to date, or are they willing to go back?
So I know you can make changes. I'm not sure if they're retroactive. So open up to the group to see if anybody knows with past cited reporting, if you can make amendments to your award, and then does that apply retroactively? So we'll have to do some research because I don't know off the top of my head. That's a really good question. So yeah, we can send you some guidance that the state's put out around that too.
Okay, because we just had a good conversation about it. And we thought, well, we're not asking for more money to do it, just asking to shift some funds. And if we already had it, if I was already doing it and we just didn't get a chance to do it, to ask them for it because our progress report wasn't due yet, or however you're supposed to ask them, I'm still learning all this stuff. So we just went, oh, well, that's too bad, because be able to shift it right away.
No, I think it's a great question. We'll get some guidance out to you. I think Melissa's just asking for your email so we can follow up with you directly. All right, wonderful. Any other questions before we move on here and turn it over and get partnerships updates? Right, I'm not seeing anything. So Brittany, I will turn it over to you.
All right, thank you so much, Gretchen. You can go to the next slide, please. All right, so today we'll just be going over the ECM presumptive authorization. We'll be discussing the unsuccessful outreach payments, and then we have just a few CalAIM updates. Next slide. Perfect. So starting January 1st of this year, all MCPs are required to allow ECM providers to quickly initiate ECM services prior to submitting an ECM referral to that MCP and reimburse providers for services during a 30-day time frame. So here we just want to kind of show an example of what the traditional ECM authorization process looked like, which was essentially ECM services would start after a referral is submitted to the MCP to authorize ECM services. And then in the next slide, you'll see the updated approach. So basically what this is showing is that ECM services can begin before. So partnership's approach to the presumptive authorization requirement does not have limitations on provider types or populations of focus. Instead, ECM provider self-identified members are presumptively approved until a treatment authorization request or a TAR is submitted and reviewed. ECM providers are going to be checking the provider portal to ensure that member is eligible for ECM and is not already enrolled in ECM. So you'll be able to see if that member does have a TAR in the provider portal, which would indicate that they're already enrolled. And then once that is complete, services can begin, and the ECM provider will then add that member directly to their RTF and IOT if applicable. And if a member has an approved TAR on file, all outreaches will be documented on the RTF. So under the ECM presumptive authorization process, all ECM providers can start services, again, before the member is added to the RTF, submitted to the managed care plan to authorize ECM services. So regarding the referral standards and your current workflow, as the ECM provider submitting referrals to partnership, that remains unaffected. So these changes are primarily for external, aka non-ECM provider purposes. And you can go to the next slide, please. All right, fantastic. So again, beginning 1/1 of this year, as part of the DHCS managed care plan payment and ECM presumptive authorization requirements, MCPs are required to pay for unsuccessful outreach. So the managed care plans may not require ECM providers to seek authorization to conduct and bill for outreach efforts to identify new members for ECM. That basically means that providers can begin to bill for unsuccessful outreach prior to enrollment for a max of 5 attempts within a 30-day rolling period. So what a 30-day rolling period is that essentially the very first day of that first attempt, that would mark the first day of that 30-day rolling period, and then so on and so forth. So within that 30-day time frame. So it's not monthly, it's a 30-day rolling period. So providers who self-identify members for ECM, again, would add them directly to their RTF and submit as part of their monthly reporting to partnership, and those members will be presumed ECM eligible. So again, I'd just like to remind everybody that at this time, we are not limiting to specific populations of focus or ECM providers. I do want to call out that there are exceptions to the MCP payment in the presumptive authorization timeframe. One of those callouts is if the member has an existing open ECM authorization with another ECM provider, the MCP is not required to reimburse for services delivered in the presumptive authorization period. DHCS allows for this exception in the MCP payment to limit instances of payment for duplicative services. The other call out is if the individual is not an active member of the managed care plan during the dates of ECM service delivery, they will not be paid for unsuccessful outreach. And go to the next slide. And then just some key reminders for submitting ECM claims for outreach attempts. So ECM providers must verify members' eligibility prior to providing any services, and you would do that on the provider portal. Any unsuccessful outreach attempts is defined as an interaction with a referred partnership member that is not yet enrolled in the ECM program, aka they do not have a TAR on file with another provider. Unsuccessful outreach attempt claims submitted for a partnership member who has already enrolled in ECM are not eligible for reimbursement, and that will result in a claim denial. There's no more than 5 unsuccessful outreach attempts to be reimbursed within a 30-day rolling period. And unsuccessful outreach attempts billed in excess of 1 per day, 5 within a 30-day period will be denied. All right. And you can go to the next slide. Thank you. And then we just basically put some registration links for our CalAIM office hours, our ECM office hours, the community sports office hours, and then we have links as well to the newly updated adult and children and youth referral. And we just wanted to call out that we will be sharing more information on IPP in late February to all of our providers. All right, and then that is it. Is there any questions?
We do have one in the chat. Is presumptive authorization only for ECM, or does it also cover the community sports?
No, so it will just be strictly for ECM.
Any other questions for Brittany? All right, Brittany. Well, thank you so much for all that information. That's really helpful.
Yeah, absolutely. Thank you.
All right, and I did want to just point out that partnership has a really amazing amount of information on their website with trainings and roundtables and office hours. And I know I was talking to a provider recently, and they had fallen off their radar, all the information that partnership has. So we just wanted to throw this back up on the slide here today, just to remind you guys that these are available to you and you can register. The links are in the slide here. So if you do have questions or you're a little confused about some of the new changes coming out, these are great places to get your questions answered. All right, next slide, please. So now we're going to jump into PATH Cited, which I am very excited about. I really am hoping that we can have some good discussion today around who's thinking about applying, what are some of the issues that are coming to mind that PATH Cited could help to address. So we're going to spend some time talking about all those things. But before we do that, I would love to just get maybe a raise of hands on Zoom about who was considering applying for PATH Cited in round 4. All right, we have 1. Sandra, I'm going to hope that's a clapping. Okay, Kelly, you're going to do it. Great. Okay. So a few of you are considering it. Well, I would love to make sure that you're all aware of what PATH Cited is available and what it is and how it potentially could help. And so we'll spend a few minutes on that today. One of the big things I want to encourage you all to look at is what is the good fit for your organization or not. This is the last round of PATH Cited funding the state's going to offer. And I know that we've heard from a lot of folks that it's been really instrumental in helping them get their programs up and running, getting that startup funding in place to help grow their programs. And so I want everyone just to be aware that it's out there. And again, this is the last round. We did hear that partnership will be making some announcements around their startup funding, IPP, in late February. But we know that those dollars are typically not as significant as what the state will provide through PATH Cited. So, just keep that in mind. So PATH Cited is really have a few priorities here, and actually a lot of you here today may fall into the priority areas. One of the big areas that the state wants to fund with this round of Cited is providers doing work in rural communities. So that's a big one. They also want to fund providers who are working in counties that have not received a lot of Cited funding. So all of our Northeast counties qualify as that as well. So just being rural and in counties that have not received a lot of Cited dollars does lift your priority up. And they're also targeting providers who do work with the justice involved population, Indian health services, folks who are interested in transitional rent. So primarily counties, again, we're thinking that's where the state's going, but it could be other organizations as well. Folks that do maternal and child health. So if you are a provider serving children and youth population of focus, that would also boost your priority level. So just start to think about what that looks like. And just to kind of whet your appetite as to what kinds of money we're talking about for PATH cited. So typically the state has done 2-year funding cycles, and the average cited award has been $1.1 million for those 2-year cycles. Round 4 is going to be a 1-year funding cycle. And there is no limit as to the amount of money you can request. But if you think about what the average could be, that could be $500,000. It could help you really increase your capacity to do ECM or community supports or start serving new populations. So just kind of think about that as we talk here today. Let's go to the next slide here. The state has put out a bunch of information on PATH cited. They've held 2 webinars so far, and both are on the website, both the slides and the recording. Excuse me. One is a general overview of PATH cited. So again, really helpful. What are the priorities? Who's eligible? How it all works. So that's great to look at. And they also have a webinar they've done, excuse me, late last week, around how to make your application stronger. And all of those things are on the website. In addition to the webinars they've already done, they also have a lot of documentation that I think is really helpful as you think about structuring your application. They have a guidance document, which is very long, but it's got a lot of good nuggets. They also, what I think is one of the more important pieces they have is a funding request workbook. So if you think about your budget for PATH cited, and how to structure that, how to make sure you tie it back to your narrative application components, that's got a lot of good information on it. And then they do have some good samples, some good recommendations for how to talk about projects in their samples that they have both for community supports and ECM. So I encourage you all to look at the links here if you're considering PATH cited. Lots of good information to help make your application stronger. Next slide, please. And then there's one more webinar that's left, which I'm very excited about. It's going to be focused on how to strengthen your application and looking really at the budget and the workbook there. And so how do you really, again, this is maybe important for folks too, as we heard some questions earlier, how do you make sure that you have the right funding amount for the things you're looking at, the milestones you want to achieve, what's considered appropriate. So the state has come out with some guidance around what's an appropriate amount in PATH cited to ask for vehicles, for technology supports. They have some guiding documents around those, and we'll cover that as well. And so I think that'll be a really important one. That's coming up on February 3rd. And then they're also going to start hosting office hours twice a week around PATH cited. Again, they really want to get folks to apply. It's the last round. We also know it's going to be the most competitive round yet. So everyone's talking about it. You know, how do we access these dollars? So there's going to be a lot of information shared and then time to ask questions and talk to each other. So I encourage you all to consider attending the webinar that's coming up and then also the office hours. Next slide, please. And then as we look at round 4 and some of the things the state is focusing in on, they did want to really have folks think about some of the steps they can take to get their application ready and to be more attractive for funding. And so one of the big changes we're seeing this year is it is only going to be a 1-year funding cycle. So the state has emphasized they want to have applicants that are ready to go. That means that once you're awarded, you are ready to implement. So if you're going to be buying a new, let's say, case management system, that you already have your vendor quotes in place so that you can go ahead and hire that vendor immediately. You don't need to take any time to go out for bid. If you're going to hire staff, really think about how many staff can you hire within a 12-month period. I just want you to be cognizant of what that looks like for PATH cited. Do you need to have any approvals either by your board or by any type of leadership to do this work and to hire staff? So if you do, get those in place. So again, as soon as you get the award for money, you're ready to go. Okay. And then that's kind of the internal conversation the state's encouraging organizations to have as they think about past cited. Externally, they really would like to have you think about how do your past cited applications really align with what are the gaps and needs that the managed care plans in your county see, that other providers are seeing. So we're going to talk about that today. Think about what are the gaps and needs, how could past cited help fill that. And then as you think about too, if you are contracted with your managed care plan to serve the population of focus in ECM that you're asking for cited dollars to support, that's great. But if you are not yet contracted with a managed care plan for either ECM or community supports, or you're not yet contracted to serve that population of focus, you need to get a letter of attestation from partnership to go ahead and process your application. And I'm sure partnership would appreciate all of those requests coming in as early as possible so they have time to process that. But you do need to work with partnership if you are not fully contracted for the population of focus or community support service that you want to request cited funds for. Any questions on this slide? All right, then let's keep going. So we did ask partnership to identify what the gaps and needs are that they're seeing in the Northeast counties for ECM and community supports. And again, this is really important because as you go to write your cited application, the state wants you to be able to have a reference point for what gaps and needs you're fulfilling, you're addressing with the cited application. This is a really important slide for that. So looking at what are the populations of focus that still have gaps in them according to partnership, you can see that by county here, which is very helpful. And then what community support services are there still some gaps and needs for in each county? So I'm going to encourage you all, if you're doing past cited, you want to hold on to this slide in particular, and you can reference that as you write your application. Any questions on this for partnership? All right, then let's go on to the next slide and talk about what are the gaps and needs that you guys are experiencing in your county, in your community for ECM and community supports. And what are some of the things that could be addressed with a one-year cited grant? And again, part of this exercise is to help us generate conversation. It's also intended to help us document some of the gaps and needs that you guys are seeing, and that can be used as a reference point. Whatever we talk about here in our CPI can be used as a reference point for your application. And then one of the things the state's talked a lot about with cited this round is how do we align our priorities and goals within our county so we're not duplicating efforts. So again, another great space for us to talk about that is here in our CPI. So what are some gaps that you guys may be seeing with ECM and community supports that maybe past cited could help with? Are we missing some providers for certain populations of focus for ECM? Are we missing some community support services?
I think for Modoc County, I think we're definitely missing community support services and probably the perinatal population. We don't have a hospital that delivers. And so a lot of our women have to travel long distance, which means they get inadequate care. They're not, the numbers of times they go see the provider, all of that is based on, is their vehicle working? Is there gas in the vehicle? Are the passes passable because it's winter or not winter? So a lot of those things influence that. So I really like the new partnership healthcare perinatal program ability to make a mini CPSP, comprehensive perinatal services program. So I really like that. I think that is definitely a gap for us.
Okay.
And I think it's for our Indian Health Clinic, that's a big one. And for, I'm sure the short-term hospital housing is important too, but I don't know. That's going to be a huge pull because we don't have, like I said, a lot of resources and that means human resources as well.
No, that's an important one. Okay, I love this, Kelly, so I'm going to push you a little bit, not just you, we can all talk about this as a group, but how could Cited help fill those gaps? What are some things that we could request funds for? And we're just brainstorming here, that we could use Cited to help address for birth equity, population of focus, for whatever community supports you think are needed. Would having a vehicle to transport folks to services, would that be important?
Yes, but also, you know, if you're saying you're limiting the amount of money you can spend on a vehicle per vehicle, you can't get a four-wheel drive, which we rely on. Some of our elders or our families live in areas that don't have paved roads, and so you are forced to four-wheel drive it up into their home to get in there because it could be miles from the paved roads if you're going to do any type of outreach like that.
I think that is a challenge, and I would encourage you, if you are applying for a vehicle to help get folks to appointments, that you talk about the challenges in a rural community of not having paved road. You know, I think that's really important, and that may create some flexibility with their funding limits.
And I noticed that we're looking for places to expand so we can provide ECM services and community health type of services and community supports. We have buildings that, yeah, they're open. They're either for sale if they're worth anything, or they're in such need of repair, it's extensive. And that is time consuming.
And expensive.
Follow all the guidelines, the county plan, the permits. It's a difficult pull, but it's needed if you're going to expand our services. And in rural counties, we don't have contractors that are just sitting not doing anything. They are totally telling us we're a year out. We're, you know, we don't know if we're going to get to you. So to me, if we were able to extend, and I know they say you can't, but extend at least one thing that makes sense like that. It's not, the funding can be allocated, right? Allocated already for this project of expanding, renovation or whatever. That's just my thoughts on that. You know, we've run into those things already, experienced it.
But that's really helpful. And I wish we could do longer than a 1-year funding cycle, but that's been pretty firm with the state. But Kelly, I'm wondering too, in terms of if we think about kind of parsing things out, and again, I'm just brainstorming here, you know, without a lot of information, but thinking about for repairs, are there certain repairs that you could ask for that could be done in that 12-month period that would be meaningful? I don't know, but I think starting to think about what can be accomplished with that 1-year funding cycle would be really helpful as well. Melissa, I see that you have in the chat, you wanted to ask if Pitt River could expand on the birth equity population of focus. Do you want to come and off and ask a little bit more of a targeted question?
I just heard that Kelly mentioned that that's a kind of population of focus that is underserved or needs additional services. And I think it would be great if that's an additional area that Pitt River Health Services wants to hone in on, but just kind of wanted to see, Kelly, what your thoughts are. I know you guys are always super busy and additional work is hard, but just kind of curious.
So currently we do Family Spirit, and we've awarded a tribal perinatal health grant with Partnership Healthcare to help get our education, all our community health workers, community health reps, Family Spirit workers, all educated. So we've done some training in Family Spirit. We've done some training in mental health, first aid, and in motivational interviewing. And these things are all important to serve our population so that we're well prepared for that. But we want to expand to you know, these are for Native families, Native mamas, but we want to expand beyond that to serve our population. The whole picture of what we serve at Pitt River is everyone. So we want to expand our perinatal program to be a lookalike CPSP as what is getting ready to be rolled out through Partnership Healthcare, and we want to bill for it because we can't do things unless we have funds, right? And we do have people that have this as a passion within our team who are really good at connecting with their perinatal population and families, and so we feel that that might be something we could step up to the plate and go forward with. But I want to get back to the the building. You know, we thought, gosh, why rural people should be able to purchase that building. If we could purchase that building, that would help us a lot more than having a time frame of a year to say, hurry up and renovate so you could provide service. If we purchased it, at least we would have time frame and use different resources of funding that we could find to get it renovated in a better, you know, in a feasible way, you know, because right now it's not feasible to no contractor, no time frame. I was told that I have a building right now that needs renovation, and all it needs is a bathroom to be just one AED expansion. But I've got to go through the county planning department, and the county planning department is backlogged. So you know, you're hurrying up to do stuff, but you're afraid you're not going to make it. So if we had the ability to purchase in our rural communities, that would help us be able to do these renovations, get them done, and expand quicker. I mean, but it's at our pace.
Right. And I think it's an amazing idea. I think Cited has some rules around, they will help pay for rental of office space, but I think and I cannot find it, of course, in the moment, but I think there is some guidance saying they won't pay for the purchase of an office building, but I should double check that to make sure I'm not mixing up guidance here.
I think somebody was paying for it because I've talked to some people who've gotten the grants, and maybe it was the first round of funding that they did it and then they backtracked or something. I'm not sure, but
we can look into that. Yeah.
If there was ability to go back and do that, it would help our rural communities immensely.
And I think also what I'm hearing from you, Kelly, and I think this is really important for everyone applying for PATH Cited from our Northeast counties, is that you guys are rural, you have different needs, different challenges than folks who are in more urban environments. And pointing that out, I think is really, really important because a lot of the reviewers for PATH Cited may not be as familiar with, you know, MODOC as they are with Orange County. So trying to make sure they understand the specific challenges that are unique to you in the rural communities is going to be important in this round of Cited. So I encourage everyone to try to get that language in there to remind reviewers.
Yeah, well, and I think that's why you see the gap, why you see
exactly
the top of the list, why you see the tribes being at the top of the list is because we don't have grant writers sitting in our office. We don't have, we just don't have the resource power that other bigger communities do. So they're not going to get an application like they do from a grant writer.
Exactly. And that's important. And I think, again, making sure they know that you're rural, that you're small, that you're local, all that is really good. And Sandra, I see you're saying, yes, we agree at Mountain Valleys with Kelly, which is good. So I think this is really good. Having these conversations, talking to each other, aligning the work that you're doing is going to be really important. And we can certainly continue this conversation. Thank you, Tina, for your agreement too. In our next CPIs, we really do encourage you guys to consider Cited. It is a good last opportunity to get some startup funding or expansion dollars to really make a difference in the ECM and community supports that you're providing or want to provide. So I'm going to just pause, see if anybody else has any last issue they want to provide. I know, Melissa, you have a few slides you want to make sure I get to, so I don't want to cut time short for you, but just want to make sure we don't have anybody else who wanted to flag an idea for PATH Cited or raise a gap that they're thinking about. All right, I'm not seeing anything else. So with that, maybe I turn it over to Ava right now to continue our conversation.
Thanks, Gretchen. Yeah, so we're going to talk with our last few minutes about our collaborative goal for 2025, and then talk about our next session, which will be in person, and some upcoming office hours and one-on-ones and things like that. So for the year ahead, we really want to make sure that we are all working towards a collective goal that the collaborative has provided feedback on. So as of now, we are starting off with this goal 1 here. And I'll just read it really quickly so we can all kind of remember what this is about. Goal 1 is by December 31st, 2025, the Northeast CPI will implement enhanced referral coordination strategies, including clear communication channels, provider training and educational resources, and peer-to-peer networking to ensure at least 75% of providers report improved referral processes and increased community-based referrals for ECM and CS. So this was informed by you all who provided the insight and the input that the referral satisfaction was one of your priorities. So this is where we're starting. This is our current goal, and related measures for this goal are to track provider satisfaction and experience of referral processes and the number of community-based referrals that have been made or submitted. So this is where we're starting. Based on additional feedback that we've gotten, we wanted to propose a potential alternative goal that is more focused on community-based referrals. So we've learned that this is another area of priority that you all are interested in tracking and working towards improving. We want to just highlight here that this does require collecting either quarterly or biannual feedback from you all in order to track provider satisfaction and the number of community-based referrals that are made or submitted. So just want to see if that is something that feels feasible to the group, if you are comfortable with goal number 1, or if you'd prefer focusing on goal number 2. And I'll read goal number 2 also, just so everyone can get a sense for what that is. It's by December 31st, 2025. The Northeast CPI will demonstrate an increase in successfully submitted or authorized community-based referrals for ECM and community supports, with at least 75% of providers reporting improved satisfaction with the process. So I'm actually going to launch a poll to see which goal you would prefer to focus on for 2025. Really quickly, I just want to see, Melissa, if you have anything, or Gretchen, to add to this before I launch that poll.
No, I think if we can just get an assessment of where people are leaning towards.
Yeah, so I just launched that poll, so please take a look at these and vote for the one that you would like to prioritize for 2025.
And as you guys are voting, if you have any initial reactions to these, please let us know in the chat. I know we're running out of time, but appreciate you guys engaging with the poll.
And I'll give it like 10 more seconds. If you haven't voted yet, please do so before I close it. All right, so I'll go ahead and end the poll now. So it looks like goal number 1 is still looking like a preference over goal number 2. So we'll take this back. Melissa, anything else to share before we move on?
No.
Okay, great. Thanks everyone for voting. Okay, so really quickly before we wrap up, we want to let you all know that our February session is going to be an in-person session on February 18th at the Shasta Community Health Center in Reading. The registration link has been sent out, and I'll follow up with an additional email. But please register via that link. Lunch will be provided. And we'll also be providing an agenda by the 3rd. If there's anything that you would like to focus on during that meeting, please put it in the chat, or also feel free to follow up via email. But if there's anything you'd like to see on that agenda, please let us know. We're also curious about whether you all would be interested in having a local ECM and community supports resource fair. So if you can just pop in the chat if that's something that you would be interested in participating in, that would be really helpful as we plan for future events. Okay, great. I see some enthusiastic yeses. We have office hours on Thursday at 10 a.m. This will be an opportunity to have a CalAIM orientation for any new or returning CPI participants. If there's also something specific you'd like to discuss, please come with questions. But the registration link is there, and we're hoping to see you in office hours. And then as always, we are available for 30-minute one-on-ones as requested if you need additional support with anything. Thank you all. That was a jam-packed session, but thank you for your engagement and collaboration. We're really looking forward to the year ahead. So hope everyone has a great rest of your week, and we'll see you on Thursday for office hours or in February for our in-person session. Thanks, everyone.
Thank you.